ดีค่ะ very good evening and welcome to Thai PBS World Tonight.
สวัสดีค่ะ good evening as well and happy 22/02/22 and this is called palindrome where you can read things both ways from the left and from the right. So very good numbers indeed for today. And kicking off the program tonight is the latest updates on the COVID-19 situation. And as you can see, the number of new infections each day keep rising, and now more than 18,000 cases a day. And to clarify, the CCSA will not impose any additional measures, even though the Ministry of the Public Health have increased the level of alert level to number 4, which is the second highest level. CCSA Assistant Spokesperson Dr. Aphisamai Sirangsan said yesterday that they had taken into consideration all aspects of COVID-19, including the number of infections and the death toll, tourism public concern about the prospect of yet another lockdown and livelihoods before arriving at the decision not to introduce any additional restrictions and not to suspend the test and go program. She also asked senior medical professionals not to make comments about the pandemic in a way which may cause public confusion or anxiety, and to clearly state that any comments they do make are their personal opinions and not those of their organizations. The Test and Go program resumed on February 1st, and Dr. Aphisamai said that only 2.5% of more than 137,000 arrivals from abroad were found to be infected. Test and Go tourists take RT-PCR tests upon arrival, positive results of which accounted for 46% of the infected among the arrivals. And the second RT-PCR test, which is administered between the 4th and 7th day or the 5th day mostly in Thailand, accounted for about 44.7% of the infections detected. And such was the basis on which the Public Health Ministry decided not to suspend the Test and Go program again, despite the surge in domestic infections, while still maintaining the requirements of the program.
At a meeting last week between the Ministry of Tourism and Sports and Tourism Associations, the tourism operators said they want certain requirements of the Test and Go program to be eased. One of them is the second RT-PCR test being replaced with antigen tests instead, as well as the insurance coverage requirement being halved to only $25,000. So these are actually the requests from the tourism associations to the ministry in hopes that it will ease the burden among the foreigners who wish to travel to Thailand, because these steps, we have to admit that they are really complicated for some of them.
Exactly. Well, we have to wait and see. The COVID infections are still, rising, stabilizing to a certain extent, but it is also expected to keep on rising, but with the less severity of the new Omicron variant will actually is quite some sort of good news even.
Right.
Probably for many, especially businesses in the tourism sector, in hospitality, that have been suffering for so long, for 2 years now.
Exactly. And in light of the current COVID-19 situation, many of the hospitals as well as isolation facilities are now on alert in case of more cases being admitted to these facilities. And recently, the Public Health Permanent Secretary, Dr. Kietiphum Wongrajit, has issued an urgent order instructing state hospital directors and provincial health chiefs across the country to prepare their medical personnel and facilities, including home isolation and community isolation facilities, to deal with an anticipated jump in serious COVID cases. In his capacity as the head of the COVID-19 Emergency Operations Center, Dr. Kietiphum explained the need to make preparations in response to the rapidly increasing number of COVID-19 infections, particularly with the Omicron variant, to ensure that the infected patients have access to medical treatment, especially those who are seriously ill. The state hospital directors and provincial health chiefs were also instructed to increase their telephone hotline capacities as well as to inform the public in their provinces of the existence of such services. The Ministry of Public Health also urged the members of the public, especially those who are over 60 years old and who are affected by any of the 7 underlying diseases, to receive the vaccine booster shots. And as we previously reported, the ministry has already upgraded the risk of COVID-19 infection to level 4, which is out of 5. So this is definitely the second highest to begin with.
And in his Facebook post today, Dr. Manuel Lee Shoeng Wong, who is an expert on respiratory diseases at Wichayut Hospital, suggested that the Ministry of Public Health switch its focus from the attempt to cut the number of people being infected with COVID-19 to reducing the number of those getting seriously ill or dying from the virus. So since the BA.1 and BA.2 subvariants are known for their easy and rapid transmissibility, he said that the best that the health officials can do is temporarily delay the infections. So when we try to delay the infections, this would be an opportunity that can be seized to speed up vaccination, especially booster doses, which can help reduce the severity of the disease and save lives.
And speaking of that situation, we have to admit that there are still groups of people who are reluctant in getting vaccinated. But because of the surging cases of COVID-19, it is better now to get vaccinated, especially those who are still wondering whether they should get booster shots or not.
Exactly. Well, this is actually the time, Kanat, that a lot of people are getting that third doses already. Some have already even got that 4th doses, but the authorities are trying to speed up because for the drive, because a lot of people are still being left out and not even get their first dose, which is quite unbelievable, but something has to be done also to convince them, to ensure that that is also covered. And turning now to the economy, despite the surge in infections since the new year and another probably mini wave after the Chinese New Year, the economy last year actually improved more than expected, despite all the current ongoing surge in the COVID-19 infections. So Thailand's economy for the year 2021 grew by 1.6%, which is better than the projected growth of 1.2%, according to the National Economic and Social Development Council, or NESDC. The deputy government spokesperson, Traisoranakul, said the Prime Minister is pleased with last year's economic performance, and the Prime Minister also vowed to push full steam ahead to restore the national economy, which is being hard hit by the pandemic, of course, in conjunction with efforts to contain the spread of the disease. The positive growth despite the COVID-19 pandemic was attributed to several economic factors, thanks to the various stimulus packages introduced by the government, be they to boost domestic consumption, the slow recovery of tourism, or increased government investment, while the government continues in its efforts to contain the pandemic and to look after those infected. And as for this year, Traisori said the NESDC has projected even a higher growth rate than last year, citing several supporting factors such as anticipated further recovery of tourism after we gradually open up to international arrivals, especially without much of quarantine, and also price controls on consumer products, also efforts to help ease also the burdens on consumers.
Okay, so we can see that last year there are some good news that the economic recovery is being seen now that many people are living almost into their normal lives despite the COVID-19 pandemic, and the numbers are actually much higher than initially expected as well. And now let's move on to another big issue, whether justice has really been served or not. The big bike rider that crashed into an eye doctor last month will be indicted with at least 9 offenses. So the public prosecutors have decided to indict on 9 charges on a police officer who fatally injured an eye doctor in an accident with his large motorcycle at a zebra crossing in Bangkok's Phaya district in late January. The Office of the Attorney General spokesperson told the media that the prosecutors in charge of the case agreed with the Phaya police over the 9 charges against a crowd control police officer. The charges are reckless driving, causing death to another person, using a vehicle which does not display a license plate, failing to drive a vehicle close to the left curb of the traffic lane, failing to stop at a zebra crossing, using a vehicle which is not insured and for which the annual road tax has not even been paid, as well as exceeding the speed limit. He also said that the public prosecutors will ask the court to confiscate the motorbike and to suspend the driving license of the defendant. The Office of the Attorney General deputy spokesman, Prayut Petrakun, said that the victim's family has been informed about this decision by the prosecutors that they have the right to demand compensation from the suspect in accordance with the Criminal Procedure Code, even though they may have already filed for compensation through the civil court. The accident, to give you a recap, which occurred in the afternoon of January 21st in front of a hospital on Phaya Road, sparked outrage on social media, which eventually led to the city police and the Bangkok Metropolitan Administration installing traffic lights at about 100 zebra crossings in Bangkok. So this case, it has prompted a lot of changes in Bangkok, whether it's the zebra crossings, the traffic lights, as well as the awareness of the safety on road crossings, as well as the existence of the pedestrians in Thailand as well.
Right, there you go, Kunat. Basically, it's all about awareness, and especially how pedestrians are actually form quite a big group in society, because some people who might just be using cars all the time or, motorcycles may not really realize that these people in society are actually regular folks like all of us. It can be any members of our families as well who actually need to use the pavement and the zebra crossing to cross the road as well. This is actually for everyone, and the awareness of that, there has been some changes, as you said, Kunat, where some people might be a little bit more aware. We have seen some motorcycles, for example, stopping by the zebra crossing just in front of it. Some others that I have noticed also over the past weeks, probably still not aware, still, still parked or riding on top of it when they were supposed to stop as well.
So the thing is, it's about the mentality of the people and respecting the pedestrians, because they have to use the road crossings pretty much all the time, but sometimes we don't even notice or we don't even care about these people because we always believe that cars must come first. So at least there are some changes and people are much more aware of it.
Exactly, and to make people more aware, Kunat, so basically in Thong province, there's been some creative campaign going on for road safety, especially for pedestrians after this tragic accident in Bangkok. So the Thong Provincial Administration held a creative road accident reduction campaign yesterday to encourage motorists to respect pedestrians right away on the zebra crossings with fanfare, with Thai traditional Koan marks dance performance right there in Mueang district of the province. So the students from the Bandit Padanasan Institute staged a cone performance featuring an episode from Ramayana epic on the zebra crossing in front of their college. The campaign instructed to all provincial administrations by the National Road Safety Committee is set to be relaunched on the 21st of every month following this accident where an eye doctor who's been known in the media as Dr. Gertai at Chulalongkorn University was struck and killed on January 21st by a large motorcycle as she was crossing on Payatai Road. After that incident, the Thong governor said the provincial administration is repainting of the zebra crossings in the municipal area to make them more visible to motorists and is installing signs to warn motorists as they keep approaching them.
Well, it's nice to see that a lot of changes are also made in several provinces across the country as well, because many people are more aware of the issue. And considering the fact that many of these zebra crossings are near schools and hospitals, many of the local administrations are much more aware of it, because accidents can happen all the time and it is time to reduce them. And speaking of that, many people seem to notice that people love to use their creativity to address a lot of problems, and the case in Thong is actually one of many to begin with.
Right, and very way to go for Thong province. And let's do hope that this will not be forgotten anytime soon, that we still have to keep in mind about the road safety, especially for pedestrians. Do share with us what you think about this issue and others, and in the comment section. And with that, we wrap up this edition of Thai PBS World Tonight. Do catch us like this every weekday at 7 p.m. right here on YouTube and Facebook Live.
And don't forget to follow us on social media, including our website, thaipbsworld.com, for all the latest updates as well as analyses. Thanks for watching, and we'll see you tomorrow. Sawadee ka.
Sawadee ka.